My son was diagnosed with Coats, a rare eye disease, 3 days after he was born. This is a 1 out of 100,000 chance, and in this video I'm going to talk about step 3 in terms of the treatment, finding out what to do next, and just the overall process of having to go through this rare disease is definitely has not been hard for us. So if you haven't seen my last 2 videos, I talked about finding the news, the MRI, and now step 3 is actually to go through a procedure called Examination Under Anesthesia. So basically you have to put him under, he's going to be asleep the whole time as they are doing this examination. They already have the MRI results, and the MRI says that they think it is Coats, but then there's also one line in there that does not 100% rule out that it is cancer. So that's slightly concerning, but at the same time it is also common, because you can never really say with 100% certainty with these things, especially if you 100% rule out cancer and then it end up being cancer. Then you have to, you put yourself at risk to get sued and things like that. So when the MRI came back, we thought that was pretty positive news, that everything was pointing towards Coats. But stay tuned to the rest of the video, and I'll let you know how the rest of the results turned out. And sorry, I'm just in my self-driving Tesla is merging to the highway. I know it would do fine, but I just like to watch just to make sure nothing funny happens. But we merged through just fine. But yeah, so the day finally came for us to go get the exam. It was bright and early, so they scheduled all the kids early in the morning. So we went there. We got met with the doctor pretty early, and when we met with him, he was still pretty optimistic. We were talking about possibly having surgery basically a week or 2 after this exam. And then from my standpoint, I just always like to think of worst case scenario and prepare for the worst mentally in my mind. I was already asking a question about what if he loses an eye, like what's the prosthetic process look like, and he kind of stopped me right in my tracks, saying we're not even at that stage yet, which is fair. You don't really know until you actually go in and do the exam. So this is more, this exam where they put you under, they actually go in, they look at the veins and do all the testing to see if the eye is responding to certain things, and they check the good eye as well just to make sure there's nothing wrong with it. And so it was bright early in the morning. We were there at 7. They put him under, took him away, and the procedure itself is only half an hour. The longest part is just waiting for the anesthesia team to put him down, wait for him to wake up, and that was the longest part. And then they escorted us to the waiting room. They got snacks and everything there, but I was feeling pretty anxious the whole time. I'm usually a pretty calm guy, but I just felt this knot in my stomach the whole time, and it was just very uneasy. Just sitting there waiting for the results, waiting anxiously for the doctor to come out. And then finally, about an hour and a half later, he finally comes out, and I don't know, just the way that he was walking and the tone and the way that he was speaking to us, it just didn't seem like it was going to be good news, and then it wasn't. So what he told us that even though he thinks it is Coats, but then clinically he thinks it's Coats, but then there's a difference between clinically what they think and then objectively what they can see in the test, which was when they went under and do all the cameras and kind of do all that testing. So when they did the examination under anesthesia, they could not confirm 100% one way whether it is Coats or it is cancer. So that was very concerning. My heart dropped again. It's I don't know, even my first visit with him, when he was doing the exam using the scanner thing on the outer eye, it's kind of like an x-ray type of thing. You get to see the picture on the screen as he's doing it. I remember him going back and forth saying, oh, this camera, this angle, he doesn't think it's cancer. But then this one, he said, oh, I think this might look like cancer. He was going back and forth on it, but eventually he discharged us and let us go home because he thinks it is Coats. because if it is cancer and life-threatening, they would have done all the treatment and exam right there on the spot. So today, I don't know, it just felt like a complete 180 from our conversation about 2 hours ago. So that was part one. And then part two is when they did the exam, they found out that he had no vision in his eye. So another very bad news for us to hear. Like, it's already bad enough that 3 days after he was born, we found out he has rare eye diseases. But there are different stages. There are 5 stages. If it was stage 1 or 2 or maybe early 3s, there's still some chance of vision. Even if the retina is detached, you can reattach it and hope for the best. But it sounds like they pretty much already ruled out vision. So we're getting later to the stage 4 or stage 5 area. And at this point, if cancer wasn't even in the picture, we're pretty much just going to be, if we move forward with the treatment, it's just going to be to protect the eyeball itself cosmetically, so you get to keep your eye without having to lose your eye. But unfortunately, with what his recommendation is that clinically, I guess there's a rule in ophthalmology that if the eye has no vision and there's even a chance of cancer, the recommendation is to remove it. And just hearing that was terrifying. Your son was just born. Like, you never want to hear like you need to get an eye removed. That's not common. That's not something that normal people have to go through or should go through. And it was just very hard news to hear. But unfortunately, that is the reality that we have to live with. And I even asked him the question myself. Like, I asked him, like, if it was your kid, what would you do? And then he even told me that he would recommend to remove it as well, even if it was his kids. And even during the exam room, there are several other doctors there who also have younger children, and they all agreed that is the best course of action. So just looking at it holistically, it makes sense. But at the same time, it's a lot to take in, and it's a lot to digest as well. Just having to hear all that. But we are kind of slowly taking it all in, figuring it out. And yeah, it was a lot to hear within like the first hour that we got in. They were optimistic about doing surgery. But now, since there's a potential for cancer, they don't want to do any surgery or poke any needles in there, because once they start treating for coats, and if for whatever reason it end up being cancer, there's a risk that it could spread to other parts of the body and then being life-threatening at that point. So they didn't do any treatment or anything then. So that's pretty much where we are. It's not the news that we were hoping for. But I don't know. It's just a lot to think about. Then, yeah. So then he started talking about the removal procedure and the prosthetic eye, how that's gonna look. Luckily, with modern technology, prosthetic eye has gotten so good that most people won't even know unless you tell them. But for me, as a parent, it still hurts me that my son had to get his eye removed basically a few days after birth. And he'll probably still live a normal life. The one eye will be all he know. That's gonna be his normal. Like, he won't feel like he lost anything. But at the same time, it's just sad to go through and even have to experience this. But yeah, so that was the news, and it was very hard to kind of take in and absorb all that early in the morning, or I guess it's never really a good time to even get the news. But we pretty much have to go back to the drawing board, kind of see all the different scenarios. And since coats and the eye cancer, they are basically twins just in terms of diseases. They look almost identical, which is why it's so hard to tell. And even today's age, at the best hospital in the world, they still don't have the technology to 100% definitively say if it is cancer or coats. So it's just how rare and unique this disease is. It's been around for over 100 years, but even so, till this day, there's still not 100% way to confirm if it's coats or cancer. And yeah, at Boston Children's Hospital, they see so many of these cases throughout the years. They have seen some where they think it is Coats and it end up being cancer, and then it's cancer end up being Coats. So they pretty much have seen it all. And have seen some other patients where the parents choose to move forward with the Coats treatment, even though there's no vision. And I'm still trying to wrap my head around that as well, because if there's no vision, like, why are we going forward with the treatment? It's a very invasive process. You can get anywhere from 2 to 6 surgery a year, and then continually for the next 20 years. So basically, as a child, you're going to be going there every single year, once or twice, to do the treatment, to do the exam. And I don't know, when it's all said and done over the course of 20 years or so, which is when it is the most aggressive, you could be you're basically seeing the doctor all the time. They're stabbing needles in your eye. And even if you do all that and they preserve the eye, there's only about 50% chance that it's going to truly last the rest of your life. So that's another thing to consider, that later on in life, it can still cause problem. It can still cause a lot of eye pain and irritation. And at that point, you still have to remove it. So it's a lot to kind of get my head around, and it's like a lot of different angles that you need to see as well. It's just the thought of like making the call to remove the eye is scary, but then there's a potential for the cancer. Me personally, I think it's a no-brainer. If it's even a 1% chance of cancer, you don't want to take that risk. I hear some of the story from the doctor that mentioned that they treat some patient for years for Coats, and then one day it end up being cancer. And then all of a sudden it's spreading all over the body, it's life-threatening, then they have to change the treatment and end up removing the eye anyway. So it makes you really question, was all that treatment worth it to preserve an eye that has no vision? It's not an easy call either way. It's not a decision that any parent wants to make, but unfortunately my partner and I are kind of stuck with having to make the decision. And even though in the back of my mind I know the answer is pretty straightforward, to kind of remove the eye, but just playing like devil's advocates and just even seeing all the different scenarios and walking through all the different possibilities inside of my head, that's what we've been kind of just playing with, just seeing all the different angles. Like if cancer wasn't involved, like, does it still make sense to remove the eye? I'm kind of leaning towards yes, because I feel like if you just remove it, that is all he's gonna know. That's gonna be his normal. He's gonna grow up living a normal life. He will never know that he lost an eye. And it'll just be one and done. And you get the prosthetic eye, which looks pretty good. Pretty impressed with that, and relieved to hear. Like, I just don't want him to live his life with his eye being a little bit different. People might make fun of it, and if we were to go with the Coats treatment path, the eye may shrink, it may look cloudy, and over time it's going to cause a lot of pain. I just don't want him to go through any pain and suffering later on in his life and then have to make the decision to remove the eye and then blame me. Like, I don't want him to have to go back and say, why didn't my parent do this when I was a baby, so I don't need to worry about the pain later in life. And in my head I did a lot of research, a lot of different scenarios to see if it makes sense or not. Because I can see in cases where if you are in the early stages of Coats, stage 1 or 2, you have, 10 to 20% chance of vision, peripheral vision. You can see lights or black color. I think in that case it's worth it to go forward with the treatment, even though it may still lead to the same result. You may still get pain later on. You might end up removing it. You still got to do the 50 treatment or whatever throughout the year to do all the maintenance treatment. But I don't know, maybe that route would still be worth it, just to have that possibility, and maybe later on in life the disease will calm down, it wouldn't be as active. But at the same time, it's just going to be always in the back of your mind. Like, you never know, one day it's just going to strike and you wake up with a lot of pain. And you have to think about, do I have to stay here in Boston your whole life to get the best doctors? Can you move overseas? Can you go on vacation? Like, what if you're somewhere far and all of a sudden you have this excruciating pain in your eyes? Is this a a lot of things to consider. But yeah, in that case, if there's some limited vision and you are level 1 or 2, I think it might make sense to go forward with the treatment. But then in my case, since our son is in the later stages, he doesn't have any vision in his eye, and on top of that, they can't even 100% rule out if it's coastal cancer. That's the most concerning part. Like, I'm not taking any chances, even if it's 1% chance, because yeah, even getting into coast disease itself, like I mentioned earlier, it's 1 out of 100,000. So that is like 0.0000001% chance. Like, you are probably have a better chance of getting struck by lightning than getting this disease. But here we are. But yeah, so it's definitely a hard time. But they did do some light treatment, steroid outside the eye, just to see how it responds. Now we got to go back and see him in a few weeks just to see, in theory, if it is coast, then this treatment, coast would respond to it better. But one thing to note is from the first visit that we've seen him until now, which is about 2 weeks later, it did not aggressively get worse, which indicates that it's likely not cancer. But yeah, so it's kind of just circling back in my head, thinking different scenarios and going back and forth. Like, what if it's cancer? What if it's not? Like, I don't know. Either way, regardless of what we do, as of today, they cannot 100% rule out that it is not cancer. So I personally don't think it is worth it to get the treatment, even if there's one chance of getting cancer and it being life-threatening. And just thinking about him going through his whole childhood of getting the coast treatment, getting surgery every single year, going to the doctor every 6 to 12 months, getting a needle stabbed in his eye. I mean, right now he's a baby, he doesn't really know or care, but by the time he's 5 or 6, he's gonna remember the doctor, he's gonna hate the experience, and then who knows, later on in life, if he end up having to remove his eye anyways, like, it makes you really question, like, why go through all of this just to preserve an eye that has no vision, versus just ripping the band-aid off and just letting him have a normal life early. He won't even know that he lost an eye, even though we do. But yeah, it's still really sad to even accept the fact that he has no vision in that eye. But the silver lining is he's still alive and healthy otherwise. He's drinking milk fine. He's growing weight pretty fast as well. And at the same time, when the doctor told us that our son does not have vision in one eye, he literally has another patient next to us that he had to tell them that their kid is totally blind in both eyes. So at least for my child, he's gonna have one eye, but he'll still have a normal life. He can be a surgeon, he can be a pilot, an endodontics. He can basically do anything besides playing baseball. I guess you kind of need all your 3D vision to do that. He can be good at golf, he can even play basketball. He probably has to wear goggles his whole life, or glasses, just to be extra safe since you only have one eye. You lose that, then yeah, there's no turning back from that at that point. But it kind of puts things into perspective again, you know, like all these bad news, and in the hospital, yeah, there's always sick kids and sick children. But at the end of the day, even though it's hard and even though we have to deal with this situation, you still have to look at the positive and try not to blame yourself, focus on the negative too much, figure out the why. But yeah, sometimes it's just random, sometimes things just happen. The disease itself, there's no cause, you never figure out why it happened, it just happened. Like, I don't know, you walk in the street, get hit by a car, why did it happen? Sometimes things just happen because they do. It's just random luck. Unfortunately, that's his luck, that's our luck. But what we can do now is just to take it a day at a time. So we did get discharged from the hospital. Now we'll follow up with the doctor again in a few weeks. We get a couple weeks to really make the decision, even though I don't really think it's a decision. It's just, yeah, we there's only 2 decisions, well, actually maybe 3. 1, remove the eye, get it over with, and yeah, once they remove it, they can send it to the lab and 100% confirm if it's cancer or not. Then we can take any other action from there. That's the only way to really rule out if it's cancer or not. And two, we can move forward with the coach treatment to preserve an eye that has no vision. And it might be coats, and then the treatment might work, but who knows? 6 years down the line, there's always a small chance that it can be coats and cancer. That is even super duper rare. Getting coats in itself is rare. Getting cancer is actually more likely than getting coats, but getting both, that is still a possibility. So you never know. Like, I don't want to take any chances. Just even if it's less than 1%, you just never know. I mean, we are where we are today, even with less than 1% chance of possibility. It's still a possibility. It's still not zero. So that's option 2, to treat it, but I don't know at what cost, and is it really the risk really worth the reward? I don't know. Actually, I do know. I don't think it is. I'd rather just get the treatment, give him his prosthetic eye, let him live his normal life, and he don't gotta get his eye jab every single year, multiple times, go under anesthesia. It's usually not even safe for kids to go under anesthesia under 6 months old. Like, there's always risks doing that too. Like, every time you go under, you might not wake up, they might put too much, they might not put enough, and yeah, there's so many more risks and downsides to going forward with the treatment and then just removing the eye. I guess the third possibility is we don't do anything, just let it ride, and then over time, I know like the signs is gonna point to his eye's gonna hurt, and then he's gonna want to pull his eye out literally, and then at that point, if we don't do any treatment, it's just gonna end up being a lot of pain. So it's gonna be pain either way. Pain to remove the eye, pain to treat the eye, and pain of doing nothing. So there's literally no good choice here. But regardless, yeah, this is stage 3 for us, step 3 in terms of deciding what we want to do, getting news, and we'll wait a few more weeks to see the doctor, and I'll keep you guys updated on the journey. And making these videos so he can at least see my thought process later on in life, if he ever cared to kind of go back and see what we went through and the decision we made and why, and everything we do is in his best interest. Like, I'm not doing this for me, like it hurts us, like there's no good decision. I prefer not to have to make the call to take out his eye, but I think it's for the best. I think he will have a more stable life, a normal life. The earlier we get it over with, more he can just adjust to his one eye and just be a one eye specialist. And I know he's gonna do great things in life. It is off to a rough start for us and for him. He has to go to so many visits, but we'll eventually get there. But like I said, we'll take it one day at a time, and I'll keep you guys posted on this journey.